Pancreas cancer can be difficult to treat, but Dr. Mary Dilhoff is here to tell us about the innovative care and expertise found at the James. Dr. Dilhoff, what is pancreatic cancer?
Pancreas cancer is any cancer that starts in the pancreas, which is a gland that helps make insulin and enzymes that help us digest food, especially fatty food.
Why is that cancer so difficult to detect?
Pancreas cancer is difficult to detect because it's difficult to see on our standard imaging studies, our CT scans and our MRIs. We are researching better ways to image pancreas cancer through things like endoscopy and specialized types of ultrasound, but at this point it's still difficult to see on our standard studies.
Is it because it's just so tucked inside the body?
It's not just because of that, because there are other organs that are very deep in the body that you can see. It's that those tumors aren't very easy to see when they're small. So we're not seeing them until you have a 1 or 2 centimeter tumor, when if we could see a 2 millimeter tumor, like that would be better. And the symptoms in the early stages are very vague.
Can you describe some of the symptoms even though they're vague?
So often people will have things that are difficult to attribute to cancer. They'll have weight loss that is not expected, feel unwell, or have a mild abdominal pain. The one symptom that usually brings people to medical attention is when their skin turns yellow or jaundiced, and that's usually when people get attention.
I've heard that pancreas cancer is difficult to treat. Why is that?
It is difficult to treat for a couple of reasons. One is we don't diagnose it early in many patients. So in about 85% of patients, they're diagnosed after it's already spread out of the initial area, so out of the pancreas into other places such as the liver or lungs. The other reason is that therapies that we have, the chemotherapies that we have, are not as effective as we'd like them to be.
How are most patients treated for pancreas cancer?
Most patients are treated for pancreas cancer with a combination of therapies. We know they do best, they live the longest and live the best when they get a combination of both surgery and chemotherapy. Radiation is sometimes used, and that's more individualized for individual patients, but we know this combination of therapies is the best.
Is there any age that this hits in particular, or is this across the gamut?
This is more common in older people. The average age is in the 70s, so most of our patients that we see range in that 60 to 80, but it really can happen to anyone.
Why should someone come to the James for care for this cancer?
Here at the James at Ohio State, we have a team of experts, and that team consists of physicians from medical oncologists to surgeons to radiation oncologists, but even as important or more important is the rest of our team, our nurse practitioners, our pharmacist, our nutritionist, our physical therapist, all those other professionals combine to make a team that really takes the best care of patients.
So you now have at Ohio State a pancreas clinic?
We do. We have a Pancreas Multi-disciplinary Clinic, and that clinic is really designed to have the patient at the center. So the patient comes in and they get to see all the experts in one single day. So you don't spend several weeks trying to get your individualized plan. The patient comes in, they get seen by our nurse practitioner in the morning. We review them all together with the radiologist at lunch, and then all the experts see them in the afternoon. So they really spend one day and they get the opinions of all the experts all at once.
And I would think, like any cancers, time is of the essence when you're trying to treat this.
It really is, especially in pancreas cancer. You really want to try to get the diagnosis and get the treatment plan. We've looked at this in our Pancreas Multidisciplinary Clinic, and that time to get chemotherapy is shorter when our patients get seen at this clinic.
Where did the idea come from to have a pancreas clinic?
This idea, so a couple of years ago, as we really started thinking about how do we best take care of our patients, this idea of multidisciplinary clinics is really growing across the country at large cancer centers. And so we really started thinking from the patient's perspective, how do they get the best care and how do we do it in the most efficient way? And these multidisciplinary clinics seem to be the answer.
Did it take long to get this in place?
It takes more work than you might think, getting a whole clinic together, from really organizing all the people that need to be in place, all the experts, all of our ancillary services that need to be there all in the same day. So it actually takes quite a bit of work to get all the people in the right place at the right time.
Can you give me an example of some of the folks that are involved in the clinic?
Yeah, there's also, from a physician standpoint, we have our medical oncologist and our surgical oncologists. The medical oncologists give the chemotherapy and the drugs typically, our surgeons, and our radiation oncologist. That's our physician component typically. But then more importantly, we have a whole team that helps. Our nurse practitioners see the patients, before we do typically. We have pharmacists that help, throughout the process with medications the patients are already on to getting their chemotherapy plan started. Our physical therapist, it's really important for patients when they're diagnosed, oftentimes they're older, and the physical therapy portion of it's really important, getting them fit enough to tolerate these treatments. And our nutritionists are really important. And as many of these patients have lost weight, they're not able to eat in the way they normally are used to. So that really helps try to get people as fit and healthy as they can so they can endure these procedures.
If someone is diagnosed with pancreatic cancer, how do they get to see you?
So once they're diagnosed with a pancreas cancer, they can be seen in our Pancreas Multi-disciplinary Clinic, so they'll get that whole team of experts. We're also happy to see anyone else with any other pancreas problem in any one of our clinics.
What feedback have you received from patients who've come to the clinic?
So we give all of our patients at the clinic a survey to fill out when they've seen us, because we really are interested in doing better and helping them better. And our feedback so far has been excellent. Patients are really happy that they can come in and get seen all in the same day. It's a long day for them, but that replaces them coming back and forth to campus on multiple different days to try to get all these pieces lined up. So our feedback has been excellent.
I would bet that these patients are just glad someone is listening.
They really want someone to listen, and I find the most important thing is having a plan. That time between them having a possible diagnosis and diagnosis to getting an action plan in place is extremely stressful for patients. And anything we can do to minimize that time period really helps them deal with this better.
What kind of research is going on at the James at Ohio State for pancreas cancer?
Research is a really important part of what we do. So we really want to make improvements in how patients live with this cancer and their overall life expectancy. Our research includes from basic science. So those researchers are whole teams of researchers that are trying to figure out the very early stages of how do these cancers grow and what therapies might work on them, to our clinical research. And in our clinical research involves everything from us collecting tissue from patients to figure out treatments that might work on therapy, and we use those tissues over in our basic science lab, to what new treatments might work. Is it a new combination of drugs that might work? Does radiation work? And so it's really the combination of all those things that makes the James really special.
What can you tell me about the clinical trials that are going on at the James?
So we have many clinical trials that are going on at the James, and they involve anything from new drugs that we might be looking at, new surgical therapies or minimally invasive therapies, to radiation treatments. And so our kind of portfolio encompasses all of those pieces. We evaluate each individual patient for how they might benefit from any of those different research studies.
I was going to say, does it depend on a patient, how far they are along in their disease, or different things like that?
Very much so. If you're early in the disease, a surgical trial or some minimally invasive treatment might be more useful in that type of patient. If someone has disease that's spread or later stage disease, then we're usually looking at different medical therapies, like different chemotherapies and different drugs that might help them better.
Knowing that this is a severe cancer that a lot of times doesn't have a very long, longevity isn't very possible. How do you keep hopeful? How do you bring that hope to your patients?
That's a great question. The way I view it is that even when patients don't do as well as what I'd like, we're still helping them. So it might be that we're helping them have autonomy or be able to have a say over how things go. So that to me is still very important, even if we're at the end of life and having end of life discussions. That to me is still an important part of what I do. So it's from the very early helping you with surgery to helping you clear through the whole disease process.